Mulago Specialized National Referral Hospital was founded in 1913 by Albert Ruskin Cook, and later in 1962 the hospital was further extended with the construction of Lower Mulago, commonly known as New Mulago. Mulago Hospital then operated a bed capacity of 1,500. From the 1960s, Mulago Hospital has been the center of excellence for patient care, training doctors and research. However, this was slightly hindered by the turbulent years of 1970s and 1980s, where the health infrastructure in the country broke down, and as such, many experts moved out of the country in search for greener pastures, while others fled for their safety. With the stability prevailing in Uganda now, some of the home-trained doctors returned and super-specialized services are being boosted in various disciplines like general surgery, internal medicine, pediatrics, neurology, dentistry and oral surgery, intensive care unit, ear, nose and throat, endocrinology, rheumatology, renal dialysis, accident and emergency, among others. The hospital has also boosted its capacity to provide sophisticated care by equipping various departments like nuclear science, laboratory, and radiology, among others.
Nuclear medicine is a branch of medicine where you have to introduce radioisotopes. Those are drugs which emitting radiation. You must introduce them in the body of the patient, either by injecting the patient, or the patient swallows, or the patient breathes the drug inside in form of gas. Once this drug is introduced in the body of the patient, it will distribute according to the organ of interest. And this equipment is called SPECT gamma camera. And the drug, since it is injected in the body of the patient, it will emit radiation. Patient is pushed inside here. That radioisotope drug emits the radiation, and the radiation passes through into the system, and system processes the image, which are called scintigrams, which come from there. The system processes the scintigram according to the distribution, and images are processed, analyzed, and parameters are given. What's the difference between this and a CT scan? In a CT scan, the patient lies also inside the machine. The source of radiation comes from the machine. The machine moves and releases the radiation. Radiation goes through the patient, and then after going through the patient and is sent to a computer, and the computer will calculate how much radiation was attenuated or stopped. And they process also that image, analyze it, and the doctor called radiologist interprets the image, depending on what was found. Conversely, nuclear medicine, radiation is now from the patient into the equipment. So when to the equipment, again the equipment will also perform 500,000 calculations to calculate the distribution of that radioactive drug in the organ of interest. It will show you what is the distribution. It will show you the interaction of that drug with part of the body. It will show you how is this drug being eliminated, everything, so that the clinician has a question to answer. So the clinician has a question, they send you the patient, and then you image the patient. The findings will give the answer. SPECT gamma camera can be used to assess all different parts of the body. If, for example, the bone, when you use it to assess the bone, you can look at the bone in terms of cancer. And then you can detect the cancer at its early stage. You can also find where the primary cause of that cancer is, or what they call a tumor. You can see how far the cancer has spread. You can also see how the patient has responded to treatment. That's only one indication of cancer. Another indication can be trauma. You can see a patient who has been jogging, like journalists who are always running around following news. You get leg pain. The soldiers, the police, standing, they get pain. You assess what they call stress fracture. They get stress on their leg and they get stress fractures. Then we can look at that. We can look at child abuse in terms of bone, when somebody is brought before court that this child has been battered by somebody, either the co-wife or the maid. You put the child under the machine, you're able to see where the occult fractures which occur there. We can also use, when doctors have operated the patient, put a fixator or prosthesis. You want to see if this prosthesis is rejected by the body or it is loosened. That's about trauma. We can also use them to look at infection of the part or diabetic foot and other bone disorders. That's only one indication of the bone. We can use it to assess the brain. Under the brain, we can look at the brain, how is the blood supplied to the brain, to see if a patient has stroke, which part of the brain is affected during the stroke. We can look at the tumors. Sometimes the neurosurgeon operates the patient to see if there is recurrence of this tumor or no recurrence. We can also use the same equipment to look at some disorders, neuro disorders. You find that people have some weird behaviors, maybe it's a serial rapist, a serial killer. You want to see which part of that brain causes this kind of behaviors in the person. Psychiatric disorders, we can assess such people here. We can also assess the brain for elderly people like dementia, HIV infections, and so on and so forth. We can use this to assess the kidneys. You can see where is the obstruction within the kidney and which kidney is not functioning well, which kidney can be removed. Sometimes kidneys also develop pressure inside. The physician called nephrologist wants to know, is this pressure coming from the kidney or the heart? Sometimes patients come after kidney transplant. And then you want to see if this patient's kidney is failing, the one which is transplanted. We calculate different parameters which will tell us the new kidney is being rejected, the new kidney is reacting to the drugs which are given there, the new kidney has been attacked by antibodies in the body system, the new kidney has obstruction, the new kidney is dead. So for you to continue with that patient, to make a decision, we must put the patient in this SPECT gamma camera. Is there safety? Yes. The radiation safety is paramount in nuclear medicine. The first safety is by assessing the patients. Not all patients will be pushed in the machine. Like say a patient is pregnant, the doctor must assess this patient to say, no, for your pregnancy, we're not going to put you on the machine. Another patient safety is by calculating the specific dose. Proper history will tell you this patient needs this investigation. Even if patients are sent there, we have a specialized physician who must assess this patient to see if there's justification for this, if indeed the gamma camera or the nuclear procedure will answer the question.
The face of service delivery at the National Referral Hospital is changing for the better, and the health workers are more determined than ever before to stick to the sacred obligation of guaranteeing hope to life at all times.
We process various samples. We do blood cultures, we do urine cultures, including urinalysis. We do analyze stool samples and many other samples. This is one of the working areas. Here we do cultures. We culture the sample from here, okay? Then after culturing, we incubate. This is the incubator. We incubate the plates from here, okay? Then we have these two machines here. There's this one on top of this. This one is a backtrack machine, which we use for blood cultures. The blood culture samples are loaded in this machine, then they're incubated. When the sample is positive, the machine will beep. Okay, then when it beeps, we remove it, then we proceed with other manual tests like subculturing from here. We subculture it into solid media, as well we make a smear for gram. Okay, now the subcultures, we incubate them, then the following morning we read. Then we identify, okay? We make an inoculum, we standardize that inoculum using this machine, okay? Then we can put in the identification plates. Then we also have AST plates. At times they are called panels, okay? Now, from there, we enter the information to the FE center, then we scan, then we enter. This is an identification as well as sensitivity testing machine, okay? We load them inside here. They go for 24 hours. Then the following morning, we get our results. We get the results of the identification, then the result of the sensitivity testing.
This is a PCR machine and it has two parts. It's called a Versan PCR. It has the extraction part and the amplification part, the thermocycler. In here is where they do the extraction of the genetic material, and it takes about 3 hours to 6 for the whole process, but usually 3 hours for extraction if it's a full run. And a full run has about 96 samples, yes.
You're most welcome to hematology department. In here, we do a number of tests, but importantly, the biggest one being complete blood count, or what other people normally term as CBC. So CBC is complete blood count. Others call it full hemogram, others call it full blood count, but it all means the same. And for complete blood count, or CBC, it's a group of tests that look at the overall health of an individual, and that test helps the doctor to be able to diagnose and know whether you have an infection, whether you have anemia or not, or whether you have any blood disorder like leukemia in your blood. And we use this machine, which is called Advia 2120. It's a hematology analyzer that it's fully automated, and it uses little sample of blood, approximately 175 microliters, to give out a result. It can give complete blood count, it can give complete blood count with its differentials. It can also give reticulocytes.
Here where we are standing, this is the chemistry unit. And in this chemistry unit, we have two machines. These are German-made machines, Aterica. This machine is 2-in-1. And here what we have this major system, and then we have this one which we use as a backup. In case we get this one failing, then we have an alternative machine that we can use. So this machine, what it does, it has very many tests that we can do. One, we can check the function tests of the liver. We can check the function tests of the kidney. We can check the function tests of the heart. We can check the levels of fats, lipids in the blood. We can be able to check the blood sugar. Then when we go to this other component, here we are able to do infectious diseases like HIV, syphilis, toxoplasmosis, rubella, COVID-19. This section can do the infectious diseases. Also, we can do the tumor markers for screening cancer. So here we can do tumor markers for the pancreas, tumor markers for the bones, tumor markers for the liver, tumor markers for the ovary and the uterus, tumor markers for the brain, tumor markers for the muscles. So all the tumor markers can also be done here. Also, this component can also do fertility tests in case we want to check the fertility of women and men. This system can also check the fertility tests. Then we are able to do, with this system, we can do what we call the critical care. In case somebody is in ICU, admitted in ICU, we have tests that we can do to analyze the status of this patient. Again, we are able, with this system, to analyze the drugs, therapeutic drugs. If a patient has been put on drugs, we are able to analyze the levels of the drugs to make sure that the patient doesn't get overdose of the drugs, or we can assess how the patient is utilizing the drugs in the body.
These are the departments which carry out tests when patients come to the hospital and are seen by physicians and the different people. Then you go for maybe lab tests where they test blood, urine and other samples, or pathology where you test tissues from the body. Then, of course, nuclear medicine where they use radioactive material, very small doses they put in your body either through an injection or which you take or inhale to check for disease or treat diseases. Then, of course, radiology is what we are very familiar with, which includes X-ray, ultrasound, CT scan, mammography, MRI.
As of April 2020, Mulago Hospital housed an estimated 1,800 hospital beds. And as Uganda commemorates 60 years of independence, Mulago Specialized National Referral Hospital is giving back to the community.
We are also encouraging the community to come for a checkup. And this we encourage everybody to do regularly. Don't wait to be sick to go for a medical checkup. And the theme is diagnostics, the light in the darkness. When you don't know what you're suffering from and you're feeling unwell, these tests are the ones which will reveal what you're suffering from. Of course, when you come and meet the doctor, the medical person, they'll take history from you and try to establish where your problem could be and then recommend a relevant test to be done. And that is when they refer you to either the lab or pathology, nuclear medicine or radiology.